Hi everyone, welcome to Arra Veterinary Clinic. My name is Mairead and today we're going to do a video of how to place a cannula. We're going to use the front leg and this dog here, my patient, is Covey. He has a pre-medication today because he's actually been neutered as well, so that's why he's a little bit sleepy. So join us for this video about how to place a cannula. So first of all, just a few reasons why we place the cannula in pets when they come into us. So one might be that they're coming in sick and they need a drip. So by placing a cannula, it's a direct intravenous line for fluids. We always place the cannula if any dog is getting sedated, operated on, anything like that, any procedures at all to keep them safe. So we want to be able to administer emergency drugs. Also, if the pet is a little bit uncomfortable, we can top up their pain medication. So basically it's a safety net for us to have this direct access into their vein. So first step that we do is we prepare everything that we need. So clippers to clip the leg, then we have cotton wool here with some surgical spirits on it to clean the area. This also helps dilate the blood vessel as well, which helps put it in. We have two different size cannulas. We have tape then to tape it in, and we also have a bandage. The other thing that's quite handy, and we don't have it in here at the minute, is Emla cream to numb the skin while you're putting it in. Covey's already asleep and he's already had painkillers, so we don't need to apply this cream at the minute. So that's everything that you need. So first step then is to clip the area. So this vein is the cephalic vein that we're going to use. So we're going to just clip the hair off it. So I just generally put a little bit of pressure here to raise it so I can feel where it is as I'm clipping, so that I get the right area. So that's it clipped now. And then you need to have either a tourniquet or an assistant to hold it up. So Anya's going to help us here now. She's going to hold up the vein for it. We'll just move the clippers out of the way. Now, so we give it a clean with our surgical spirits, and then you can have a little look to see what kind of size vein you're dealing with. So we have two cannulas here, so I'm going to go with the smaller one for Covey today. So this is a 24 gauge one. Next step then that I do is our tape. So this is what's going to hold our cannula in place. So everyone has different methods with the tape. We generally do 2 strips like this and just have it ready to go. When your dog is awake and moving around, you need to have everything ready to go. I find it handy to put a little tear in that one, and I'll show you why in a minute. Perfect. So yellow cannula. Open it up. So with the cannula, there's winged cannulas and ones without wings. The one that we have here at the minute doesn't have wings. Normally we do get one with wings, they're handier to hold in. That's our bung then for it. So bevel. So on the cannula there's a bevel on it where the needle is. So bevel up. You want to go? So you find your vein. If you're not sure where the vein is, don't go in. If you want to have a feel, so we can feel the vein nice and raised here, but if you're not sure, what you can do is you can ask the person that's helping to release it, and when they release it, that will flatten again, so then you know you're in the right spot. So we get it back up, and again, if you're not really feeling it coming up properly, if you do a little bit of movement like that, it can help fill the vein as well. So we're getting a nice vein coming up here. So 45-degree angle into the vein. And when you're getting your flash back like that, advance a tiny little bit more and then off the needle. So now that one had to be moved a bit because it was up against the edge of the blood vessel. So just move it around, clean your area. Now we put the tape on. So I do one on top to hold it in place, like that. Just give it a clean again. again. And then your other one underneath. So where that little cut is on it, you can slide that up around it to hold it a bit more securely up like that. And then around the back again, so that you have it nicely secured. So in that video there, we got a flashback and we advanced it a tiny bit, but the flashback stopped. And the reason for that is if you think of it as a tube, what had happened was the cannula had hit the side a little bit. So by moving it slightly out, we got a flashback again and we redirected it straight in. So that's why the flashback stopped on that one. So that's it secured now. You can apply more tape then just to keep it in place. Pro wrap, vet wrap, any of those kind of ones that will stick down on themselves. So that's it in place there, and we've just covered it up now so that nothing will happen while we prepare Covey for surgery.